And now we get to cohort series. Now, what is a cohort? A cohort is a group of patients that share a common trait. And we're going to identify them and follow them up over time. And there's our difference between a cohort study or cohort series and a case control series. In a case control series, remember, we have a snapshot in time, we make a diagnosis, and we looked what happened up until that point. Now, with a cohort series, we're going to identify a trait in a group of people, and we're going to follow them forward in time. Now let's look at an example. Leroux and colleagues, they included mother-child pairs born in a peri-urban area of the Western Cape here in South Africa. And they followed these pairs up for a year, and they looked at the development of pneumonia. So the start of the study was a point in time, and that was at birth. They then follow these children and mothers up for a year, and they look for the development of pneumonia. If we were to reconstruct that as a case control series, we would go to the clinic and identify children with pneumonia, make a control group of children without pneumonia, and then look at data points up till that point. So you can clearly see the difference between a cohort series looking forward in time and a case control series looking rearward in time. Now I want to bring up two very important definitions: retrospective and prospective data analysis. People use these terms differently. Let's come up with one way to properly use them. Now, retrospective data analysis is usually used in terms of case control series. We identify, for instance, patients with a complication after surgery and those without. We go to the patient's files and we gather data in those files, from those files, up until the point at which those complications occurred. Now, these usually come from freehand notes made by clinicians, so those notes were never designed to contain specific data points, specific variables. We've got to extract it from that. And that is really called retrospective data analysis. We retrospectively get some data out of a patient's file. Now, prospective is used much more commonly in terms of cohort studies. We identify the patients for our trial, for our study, I should say, at the beginning of the study. So at birth, we now have a form. We've designed a form, and because those are the data points we want, we put them on the form, and that is what we want. So the data that we gather every time we phone those patients, every time we see them in the clinic, is prospective data collection. Now, it's not so clear-cut, because in this day and age with computers, we can have databases. So I can have a database in my ward whereby I collect data on certain operations, prospectively, whether they're part of a trial or not, whether they're part of a study or not. That is the data I collect. That's clean data because there's little boxes that I want the clinicians to fill in. I can now do a case control series with complications without looking at that data. That data was really collected prospectively. I could also decide I want to look at children with pneumonia and without pneumonia, and I have not included them at the start of a trial, but at the end, I'm just going to grab their files from the clinic, and I'm going to look at them again, though from birth, but get that data from a file that had that data entered without being part of a trial. So that would really be retrospective data collection of a forward-looking cohort trial. So you can see those things in both directions. So in short, those would be cohort trials, prospective and retrospective data analysis. Now you might imagine that these children, in our example, were followed up for a year. Just the last word, it needn't be that long a follow-up to make a cohort trial. I might just want to follow up patients for the first 5 days after surgery and see what happens to them, do complications occur. Now, next up, we're going to look at the exciting world of experimental studies.